Today, I have some alarming news about the low FODMAP diet for IBS and the harm it may cause, especially if you have a history or risk of eating disorders. I'm Heather Van Vorous, IBS advocate and author of the best-selling books Eating for IBS and The First Year IBS. I've been helping people with irritable bowel syndrome for 30 years, and I'm here to help you too. And if you enjoy this content, please subscribe to my channel by touching the subscribe button below. So on to this alarming news. Researchers are now debating if the low FODMAP diet for IBS is helpful or harmful. And have you gone back and forth with your own doctor about what you can and can't eat for IBS? Well, it turns out the doctors can't even agree amongst themselves. It actually turns out that the risks or benefits of the low FODMAP diet might depend on your eating disorder history and risks. And if you're wondering what on earth a FODMAP is, it's just an acronym that stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. FODMAPs include fructans, galactans, polyols, fructose, and lactose. In plain English, a FODMAP is just a type of short-chain carbohydrate that for some people is poorly digested in the gut, and that can cause a lot of bloating and gas. FODMAPs are naturally found in certain fruits, vegetables, milk, and wheat. So back to the low FODMAP controversy. On one side of the debate, Dr. Kyle Staller, an associate professor of medicine at Massachusetts General Hospital and Harvard Medical School, worries that the low FODMAP diet can trigger or worsen eating disorders, especially if doctors don't ask about a patient's eating history first. Many people with IBS already fear food, and how could you not if you're in pain and agony every time you eat? This means that many people with IBS already restrict what they eat. So following the low FODMAP diet on top of this could worsen unhealthy eating habits or even lead maybe to an eating disorder. To complicate things, it turns out that up to 1 in 5 IBS patients may already have signs of disordered eating, sometimes without even realizing it. And adding on to this may be a bit of a two-way street, because there's also evidence that restrictive eating earlier in life can increase the risk of developing IBS later on. Now, on the other side of this debate, Dr. Anthony Lembo, the Director of Research for Cleveland Clinic's Digestive Disease and Surgery Institute, argues that the low FODMAP diet is safe and effective when done correctly. Studies show about 50 to 70% of IBS patients improve within a few weeks on a low FODMAP diet, especially their bloating and pain. But Dr. Lembo also emphasizes that the low FODMAP diet should not be a permanent one. It should only be used as a short-term plan to identify your particular FODMAP trigger foods, if any, followed by a careful reintroduction of those foods. The key here is that a low FODMAP diet is not meant to be a universal blanket exclusion where you just avoid all high FODMAP foods forever and ever. That is actually exactly how you are not supposed to do this diet. So if your doctor just handed you a flyer with a list of high FODMAP foods and said, "Here, don't eat these," that is wrong. If you're in that boat, call your doc and ask for a referral to a dietitian who knows both IBS and the low FODMAP diet, so you can get the personalized help you need here. You might also let that doc know that what they're doing is not really kosher. So what does it mean that the low FODMAP diet should be personalized? It means that this is supposed to be a short-term process, maybe 12 weeks total, that number one, temporarily removes all high FODMAP foods. Then number two, gradually reintroduces these FODMAP foods one at a time. And number three, then tailors your low FODMAP diet based on what you personally tolerate and do not. In other words, a low FODMAP diet needs to be tailored so that it is unique to your gut needs. The low FODMAP diet goal is actually to expand your IBS diet, not shrink it. And remember, you might not have any FODMAP intolerances at all, which means the whole low FODMAP diet is useless for you. About 30 to 50% of all people with IBS are in that boat, including me. The tip takeaway here is that a low FODMAP diet might work well for IBS, but only if it's carefully tailored to you. It should be short-term, guided by a professional who knows the low FODMAP diet, and personalized. It should not become a long-term, highly restricted diet. And, critically, the low FODMAP diet may not be appropriate at all for people with a history of restrictive eating. While this diet may not cause eating disorders by itself, it can worsen restrictive eating in people who are already vulnerable. Doctors and dietitians should screen IBS patients for disordered eating before they recommend the low FODMAP diet, especially if that patient already has a history of food restrictions, a fear of eating, or an eating disorder. To learn all about IBS, go to the pinned comments and description below to find a link to my Getting Started page on helpforibs.com. And if you're struggling with your IBS diet, start with my video on the 10 Commandments of Eating for IBS right here. And as always, please know you are not alone.